Today, we're exploring the fascinating world of uncommon diseases. From rapid aging in children to conditions with mind-boggling histories, we'll take you on an extraordinary journey into some of the rarest disorders affecting humans. 1. Progeria. Progeria is a rare genetic disorder caused by a mutation in the LMNA gene. This mutation leads to the production of an abnormal protein called progerin, which accumulates in cells and causes them to deteriorate. Children with progeria experience rapid aging, developing symptoms such as hair loss, joint stiffness, atherosclerosis, and a characteristic facial appearance. Life expectancy for individuals with progeria is typically around 14 years, with cardiovascular complications being the primary cause of death. 2. Wolfram Syndrome. This rare genetic disorder is caused by mutations in the WFS1 or CISD2 genes, affecting various systems in the body. The primary symptoms include juvenile-onset diabetes mellitus, optic atrophy, vision loss, diabetes insipidus, excessive thirst and urination, and sensorineural hearing loss. Additional symptoms can include neurological issues, urological problems, and psychiatric disorders. There is currently no cure for Wolfram syndrome, and treatment focuses on managing individual symptoms. 3. Stiff person syndrome. The exact cause of stiff person syndrome, SPS, remains unknown, but it is believed to involve an autoimmune response that targets an enzyme called glutamic acid decarboxylase, GAD, which is essential for the proper function of nerve cells. SPS is characterized by muscle stiffness, rigidity, and painful spasms, primarily affecting the axial muscles, trunk and limbs. Treatment for SPS often includes medications to control muscle stiffness and spasms, such as benzodiazepines, anti-seizure drugs, and immunosuppressive therapy. 4. Harlequin Ichthyosis. This genetic disorder is caused by mutations in the ABCA12 gene, which disrupts the normal development of the skin. Infants with Harlequin ichthyosis are born with thick, hard, armor-like plates of skin that can severely restrict movement and make it difficult to breathe. Treatment includes intensive skincare, such as applying moisturizers and emollients, and managing complications like infections and respiratory issues. Advances in neonatal care have improved survival rates for affected infants, but the condition remains life-threatening. 5. Guillain-Barré Syndrome. This rare autoimmune disorder occurs when the immune system mistakenly attacks the peripheral nervous system, leading to inflammation and damage. Symptoms include rapidly progressive muscle weakness, loss of reflexes, and numbness or tingling in the extremities. In severe cases, paralysis can occur, and respiratory failure may require mechanical ventilation. Treatment options include intravenous immunoglobulin therapy and plasma exchange. Most individuals with Guillain-Barré syndrome recover, but some may experience lasting effects or relapses. 6. Churg-Strauss Syndrome. This disorder is characterized by blood vessel inflammation, tissue damage, and the presence of an abnormally high number of eosinophils. Symptoms can vary widely depending on which organs are affected but may include asthma, sinusitis, skin rashes, joint pain, and neuropathy. Treatment typically involves corticosteroids and immunosuppressive drugs to control inflammation and reduce eosinophil levels. 7. Kuru. Kuru is a prion disease that was found primarily among the Fore people of Papua New Guinea who practiced ritualistic cannibalism. The disease is transmitted through the consumption of infected brain tissue, which leads to the accumulation of abnormal prion proteins in the brain. Symptoms include tremors, loss of coordination, and progressive neurological decline, ultimately leading to death. With the cessation of cannibalistic practices, Kuru has become exceedingly rare and is virtually extinct. There is currently no cure or treatment for Kuru, as with other prion diseases. 8. Ondine's curse. This rare disorder is typically caused by a mutation in the PHOX2B gene, which affects the development of the nervous system and its control of involuntary functions like breathing. Individuals with Ondine's curse fail to automatically control their breathing, especially during sleep, which can lead to respiratory failure, cyanosis, bluish skin color, and even death. Treatment often involves the use of ventilators or positive airway pressure devices during sleep to assist with breathing. 9. Naegeli-Franceschetti-Jadassohn Syndrome. This rare genetic disorder is caused by mutations in the KRT14 gene, which plays a critical role in the formation of keratin proteins in the skin. Affected individuals experience a range of skin abnormalities, such as hyperpigmentation, thickened skin on the palms and soles, and nail dystrophy. A unique feature of this disorder is the absence of dermatoglyphs, fingerprints. Treatment is mainly focused on managing symptoms, as there is currently no cure for the condition. 10. Erdheim-Chester Disease. This rare form of non-Langerhans cell histiocytosis involves the excessive production and accumulation of histiocytes, a type of immune cell, which can cause organ damage and inflammation. Erdheim-Chester disease can affect multiple organs, including the bones, skin, brain, heart, and lungs. Symptoms vary widely depending on the organs involved but may include bone pain, neurological deficits, heart dysfunction, and respiratory problems. Treatment options include corticosteroids, immunosuppressive drugs, and targeted therapies like BRAF inhibitors for those with specific genetic mutations. These uncommon diseases often require specialized care and management, and advancements in medical research continue to help improve the understanding, diagnosis, and treatment of these rare conditions. Thanks for watching. Don't forget to like and subscribe.